Hey everyone, and welcome back to the channel. Today we're talking about something we've all probably been warned about: mixing alcohol with antibiotics. We've all been there, right? You're feeling sick, you get a prescription, and then you're told to lay off the drinks. But is a little sip of wine or a beer really that big of a deal? Let's get into it and separate the myths from the facts. First off, what are antibiotics even doing in our bodies? These are powerful medications designed to fight bacterial infections, like strep throat or a UTI. Some, like penicillin, work by actually blowing up the bacteria's cell wall. Others stop the bacteria from making essential proteins, which prevents them from growing and multiplying. When you take an antibiotic, it gets absorbed into your bloodstream and goes to war against these harmful bacteria. This process takes a lot of energy and resources. That's why it's so important to stay hydrated and well-nourished when you're on a course of antibiotics, because your body needs all the help it can get. So, what happens when you throw alcohol into the mix? The problem isn't usually that alcohol makes the antibiotic less effective, which is a common myth. The real issues are a bit more complicated. First, you're looking at an increased risk of side effects. Many antibiotics can already cause things like nausea, vomiting, or diarrhea. Guess what? Alcohol can cause the exact same symptoms, plus dizziness and drowsiness. When you combine them, you're basically amplifying those unpleasant feelings. Some antibiotics like doxycycline and amoxicillin are already known for being tough on your stomach, so adding alcohol is just asking for trouble. Second, mixing the two can actually make it take longer for you to heal. Alcohol impairs your immune system, making it harder for your body to fight the infection. It also messes with your ability to absorb vital nutrients. It can spike your blood sugar, and it drains your energy. Plus, alcohol disrupts your sleep, and we all know how crucial rest is when you're sick. All these factors combined just slow down your body's natural healing process. And third, you have to worry about dehydration. When you're sick, staying hydrated is non-negotiable. Your body is working overtime. Alcohol is a diuretic, meaning it makes you pee more and lose fluids. Becoming dehydrated makes it much harder for your body to recover from an infection. Now let's get specific. While it's a bad idea to mix alcohol with any antibiotic, some combinations are particularly dangerous and can cause severe reactions. If you're on medications like metronidazole, tinidazole, or Bactrim, even a small amount of alcohol can trigger flushing, a pounding headache, intense nausea, and a rapid heart rate. We're not just talking about a glass of wine either. Even some mouthwashes and cough syrups contain alcohol and can cause a reaction. Then there are antibiotics like linezolid. These belong to a class of drugs called MAOIs. When you mix them with alcohol, especially theramine-rich drinks like red wine or beer, you risk a dangerous spike in blood pressure. This could even lead to a serious event like a heart attack. Other antibiotics like isoniazid and ketoconazole are already hard on your liver. Since alcohol also negatively affects the liver, combining them can lead to severe liver damage. And finally, for some antibiotics like doxycycline and erythromycin, alcohol can actually reduce their effectiveness by messing with how your body absorbs them. This means the infection might not clear up, or it could come back even worse. The bottom line is, you should always talk to your doctor or pharmacist about the specific antibiotic you're taking. So, you've finished your prescription. How long do you have to wait before you can have a drink? It's tempting to pour a glass the day after you take your last pill, but hold on. Just like it takes time for alcohol to leave your system, antibiotics also need time to clear out completely. The general rule is to wait at least 48 to 72 hours after your last dose. For some of those stronger antibiotics we mentioned, like metronidazole, doctors recommend waiting a full 3 days to be safe. But what if you make a mistake? You're on antibiotics and you absent-mindedly take a sip of wine. First, don't drink anymore. Then, pay close attention to your body. If you start experiencing a severe throbbing headache, a racing heart, flushed skin, blurred vision, confusion, or severe weakness, you need to contact a medical professional right away. These could be signs of a serious reaction. Now, even without alcohol, antibiotics can be tough on your system. They can disrupt the good bacteria in your gut, leading to side effects. To help your body, focus on eating the right foods. Probiotics are your best friend here. Found in yogurt, kefir, and kimchi, they help restore the healthy balance in your gut microbiome. Prebiotic foods like onions, garlic, and bananas act as food for those good bacteria, helping them grow back stronger. Fermented foods are also excellent. And once you're done with your antibiotic course, load up on high-fiber foods like beans, berries, and whole grains to support your gut health. Remember to always finish your full prescription, even if you start feeling better. This is crucial to prevent antibiotic resistance, which is a huge global health problem. To sum it up, mixing alcohol and antibiotics is just not worth the risk. It can make you feel worse, slow down your healing, and in some cases, cause dangerous reactions. It's always best to just avoid alcohol until you're done with your medication and have given your body a few days to clear it out. Thanks for watching, everyone. I hope this cleared things up. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more health and wellness content. Stay safe and be well. This video is for educational purposes only and is not medical advice. Always consult a qualified healthcare professional before drinking alcohol while taking antibiotics or making decisions about your medication.